A little bit about where we're sitting before we get started. The Woodrow Wilson Center was founded in 1968 by Congress as the official living memorial to President Wilson. As he was our only president to have earned a PhD, this center aims to unite the world of ideas with the world of policy. The Global Health Initiative, the program for which I work, is a new project at the center, formed in response to the fact that nearly every one of the 20 programs and projects at the center addresses health in one capacity or another. In addition to serving as a clearinghouse for health work, we focus on four main topics: health's impact on development, the role of international and national institutions in health policy, infectious diseases, and emerging health technologies. Given this last priority is fitting, we are teaming up with the people from Nanotech on this project. A little bit about the Nanotech project. The project on emerging nanotechnologies is an initiative launched by the Wilson Center and the Pew Charitable Trust in 2005. It is dedicated to helping businesses, government, and the public anticipate and manage possible health and environmental implications of nanotechnology. In planning this session, it struck us that we are fortunate to be at the Wilson Center, as it is uniquely equipped to hold collaborative programs on diverse issues such as nanotechnology and global health. Today's event is titled Using Nanotechnology to Improve Healthcare in Developing Countries, and we are lucky to have four leaders in health and technology here today. Dr. Andrew Maynard is the Chief Science Advisor to the project on emerging nanotechnologies here at the Woodrow Wilson Center. Dr. Piotr is a Senior Scientist and Co-Director of the Program on Life Sciences, Ethics, and Policy at the McLaughlin Rotman Center for Global Health, a Professor of Medicine at the University of Toronto, and a Distinguished Investigator of the Canadian Institutes of Health Research. Dr. Piotr Grodzinski is the Director of Nanotechnology for Cancer Programs at the Nanotechnology Alliance of the National Cancer Institute in Bethesda. And moderating our session today will be Dr. Jeff Spieler, who is the Chief of the Research Division at USAID. One final note before we begin. We are webcasting this event, so when we come to the Q&A, please wait for a microphone so that those watching online can hear you and state your name and affiliation. Also, for those of you watching online, please note that the PowerPoint presentations are downloadable from the page you're watching from, so that you can follow along with the speakers. So with that, I pass it along to Jeff. Thanks. Wherever you like.
I'll just stay seated. So, as Gibbs said, my name is Jeff Spieler, and I'm the Chief of the Research, Technology, and Utilization Division in the Bureau for Global Health at USAID. And Gibb and his colleagues here at the Woodrow Wilson Center invited me to moderate this very interesting session for two reasons. The first reason was because I've spent my entire career working at the interface of developing new and improved technology and trying to get the results of that technology used in developing countries so that technology will actually improve the lives and well-being of people in low-resource settings. And secondly, I was invited because they wanted somebody who didn't know anything about nanotechnology. They didn't want me to be constrained by knowing too much about the field, because they preferred that I sort of brought to the table and to the discussion some of the issues about innovations in technology and how do you make sure that they get used in low-resource settings. Well, the fact is I accepted this honor, and I consider it an honor, thank you, because I thought it would give me the opportunity, it would demand of me the opportunity to learn more about nanotechnology. It's a subject I have followed, like many others in the room, perhaps by reading about it in newspapers and a couple of scientific articles on some breakthroughs, but not really paying much attention to it. And I thought by taking this assignment I would be able to read up and learn more about the subject. So the center indulged me and gave me lots of reading material, and I read everything that was presented to me. And I was told to please not become too much of a technician in this field because it might interrupt my role as moderator. So believe me, you can read an awful lot at your desk and still not know too much about a subject. And hence we have these marvelous speakers to present a wide range of interesting topics for us. Our first speaker, and I'm going to repeat a little bit of what Gibbs said because some people joined the webcast late. And do we have an overflow room where there are some people right now? So some people may come in late. So our first speaker is Andrew Maynard, who you heard already, serves as the Chief Science Advisor to the Woodrow Wilson Center Project on Emerging Nanotechnologies. He's a physicist trained in Birmingham and Cambridge universities and has had an outstanding career in science and technology, including nanomaterials. Dr. Maynard is going to present an overview of this exciting field, sort of a nanotechnology 101, or for those of you who were traveling in the early and mid-'70s, what we used to call a Cook's tour of nanotechnology. So, Peter, if you'd be so kind as to make your presentation, we'd be grateful.
Thank you, Jeff. Let me just start it up. Okay, I'm going to sit here and go through this. I had named this Nanotechnology a primer, but a Cook's tour sounds even better. What I was asked to do is just to give you a really short feel, an idea of what nanotechnology is in the broader sense before we go into discussing the specifics of what the implications are to developing countries in terms of how they can use this technology. So over the next 10-15 minutes or so, I'm going to start off with a very, very broad view, then hopefully begin to focus down a little bit. And for the people that are in the overflow room or watching this on the web, I'll tell you which slides to look at. If you click on the document which is on the web, you can actually see this document and hopefully follow the slides through. So let's start with this first slide, which is labeled slide number 1. And let me talk through what you're seeing here. This is something of an iconic image which was published in the year 2000 from the IBM research labs. And what you're seeing is an ellipse of cobalt atoms on a copper substrate. So each of these little blips you see here are a little atom, and they're arranged in an ellipse. And of course, an ellipse has two focuses. And what you're seeing on the right-hand side is one particular atom which has been placed at one focus of this ellipse. But then you'll see at the other focus on the left-hand side, that little area of purple there. And what is being seen here is an effect, a change in electron density, if you want to get technical, because of what has happened at the other ellipse. Now, that seems incredibly technical, but what essentially you're seeing is scientists doing something at an atomic scale, at an incredibly small scale. Well, what has this got to do with nanotechnology? What has it got to do with the developing world? I put it up here because it demonstrates one of the fundamental principles of nanotechnology, and that's the idea that we now have the tools not only to be able to see individual atoms, but also to do things with them. In this case, the scientists have picked up individual atoms and placed them in a specific place. But then they've gone one step further than that. They've actually used this ability to mess around with individual atoms to do something. In this case, create a small purple blip at one part of this diagram. Well, you may say that's not particularly exciting, not particularly important, but the concept is incredibly important. This ability to engineer or to manipulate or to play with the world around us down at the level of individual atoms. So that's one of the big concepts, the big ideas behind nanotechnology. But of course, it's much broader than that. And if we move on to the second slide here, I want to put up a fairly general definition of what nanotechnology means to many people. This isn't a formalized definition, but it's one that I particularly like. And it's one that was introduced by the late chemist Richard Smalley, who was very, very influential in developing the area of nanotechnology and some of the particular applications. And he liked to define the area of nanotechnology as the art and the science of building stuff that does stuff at the nanometer scale. I particularly like this because it's got that word art in there. Nanotechnology is more than just the science. It's what you actually do with it and actually working creatively with the tools that the scientists enable us to play around with. But also it's this idea of actually doing something, using this ability to play around at the nanoscale and use that for some useful purpose. And then you've got this final aspect, talking about the nanometer scale, talking about an incredibly small scale. Let's explore that in just a little bit more detail in slide number 3 here, because I can talk for 15 minutes about the nanoscale. I can guarantee that there are going to be some people here that still have no concept of what I'm talking about. And I know that because I find it very, very hard to conceptualize myself how small the nanoscale really is. So I thought I would put this up just to give you an idea of what we're talking about. And what you see here is a chart of comparative sizes. And if you look at the top of the chart, first of all, we're going from the human scale on the left-hand side. You have a small child there around about 1 meter high, all the way down to the nanoscale on the right-hand side. And you can see as you go down to smaller and smaller scales, we're talking about smaller and smaller things. So if you look at the top level, if you're looking at the largest particles of dust you can get up in the air, you're talking about particles which are about 1 millimeter in diameter. We understand what 1 millimeter is. And then round about at 100 micrometers in diameter, you've got something like the width of a human hair. So again, it's a scale that we can just about visualize. And then below that, you get particles as small as 5 to 10 micrometers in diameter. These are some of the largest particles that can actually lodge into your lungs if you breathe them in. And then down at the smaller scale, if you're looking at 100 nanometers, so this is the top end of the nanometer scale, you're looking at particles such as you would get if you burn something or if you're welding and you can see that fume or that smoke coming from the welding process. And then down at the very, very smallest end, the nanometer scale, you're looking at particles and materials that are just 1 to 2 nanometers in diameter. And a nanometer is roughly the same distance as 10 individual atoms lined up. So an incredibly small scale. But even just putting those up, I certainly find it very hard to visualize what that means. So have a look at the bottom part of this scale here. Look at the relative sizes. And this is something which really blows my mind. If you imagine that something like the moon was the size of a child, and look at comparative products compared to the size of the moon. If you take something like a tennis ball would be something like 50 nanometers in diameter, or the head of a pin would be 1 nanometer in diameter. So the difference in scale, going from the human scale down to the nanoscale, is the equivalent of taking the moon and putting the head of a pin on the moon. That is an incredible range of sizes that we need to get our heads around. But that is one of the really fascinating things about nanotechnology. It's enabling us to move into an area that we've never really been able to work with before and never really been able to take advantage of before. So that's a little bit on scale. What does this mean in practice? We've got this idea of nanotechnology, of working at this incredibly small scale to engineer new products. What does that mean in practice? Well, perhaps the most obvious thing is how it affects consumer products. And I'm now on slide 4, which shows a small range of products which are allegedly based on nanotechnology that you have out there. So if you go out onto the internet or into the stores now, there are a number of things you can buy which are based on nanotechnology. And just to give you 1 or 2 very, very quick examples. You can buy stain-resistant clothing. This is actually a tie. It's a silk tie which has been coated by a nano-engineered substance to make it stain-resistant. And in fact, if I were to spill my coffee on this, you'll see it roll straight off. So one very simple application of nanotechnology. Another consumer application. This is an insulating insole, thermally insulating insole. The interesting nanopart of this is actually the holes in this. It's constructed from millions upon millions of nanometer-sized holes, which means that we can have something which is incredibly effective at preventing the heat leaving the foot or cold getting to the foot in something which is very thin, a very unusual aspect of nanotechnology. Another example, here we have sun lotion, sun cream. And this is particularly interesting because the active ingredient in here is not a chemical as we would know it, but it's actually nanometer-sized particles. And these are small particles of titanium dioxide which have been engineered so they're transparent to visible light, they look clear on the skin, but they very effectively block ultraviolet light. A very nice example of actually engineering something at a very small scale so it works more effectively. And then my final example is an example of a cosmetic coming out of the UK. This is actually a face cream that uses a relatively newly developed material called carbon-60. Carbon-60 molecules are actually like little soccer balls of carbon atoms. And again, it's something which we can produce and use using nanotechnology. And we're beginning to see materials like this incorporated into cosmetics. Well, those are just 4 examples. And again, you may say, okay, consumer products relatively trivial. There must be more to nanotechnology than this. And of course, yes, there is. This is really just the tip of the iceberg of the nanotechnology revolution. And we're beginning to see far more exciting applications of this technology, this ability to engineer at such a small scale. And I want to finish off just by giving you a taste of 4 different areas that this technology is beginning to be developed in, and specifically 4 areas that are going to be particularly significant to the developing world. The first example, and this is moving on to slide 5, is the area of new materials. One of the things that this ability to engineer at this incredibly small scale allows us to do is to create materials which have got far higher performance than anything we've been able to develop in the past. In fact, the logo that I put up here is light as plastic, strong as steel. That is not hyperbole. One thing that nanotechnology enables us to do is to produce new materials which have the strength of metals but the lightness of plastics. This is incredibly exciting, not only in areas such as cars, planes, spacecraft, but also imagine what it can do for shelters and the housing industry. The ability to produce construction materials which are both very strong and incredibly light. So that is one very exciting area of development where we're beginning to see products come out onto the market, and we're going to see many, many more products over the next few years. The next example, moving on to slide 6, is in the area of water treatment. And I put the slogan up here, clean water, anytime, any place. One of the things that nanotechnology is enabling us to do is solve some of the perennial problems of providing clean, potable water. And some of those problems involve the energy cost that you need to put into cleaning water, the ability to have a system which will clean water wherever you are in the world. Nanotechnology is offering us a number of solutions to some of those problems. One particular set of solutions allows us to filter dirty water very, very effectively. So you can have technologies where just by using the power of suction or human power, you can take dirty water and very efficiently produce clean water which is drinkable, easily usable. Other technologies here are technologies for disinfecting water. So you can imagine you can have an engineered nanomaterial where you can put dirty water into a container, and just by using the power of sunlight, you can purify that water very, very effectively, very easily. And there are a number of other areas where nanotechnology is providing solutions to problems that we face in producing clean, usable water to large amounts of the global population. The third area that I want to highlight, and this is on slide 7, is the area of energy. Specifically, the area of energy production. And here I've taken a slogan from a US company called Kanaka. And this slogan is Power Plastic. This is the product which they're making. Power Plastic that converts light to energy anywhere. In many ways, a holy grail of renewable energy. How do we harness something like the energy of the sun effectively, cheaply, anywhere where we are around the globe? Nanotechnology is, again, providing solutions to these problems. In this particular case, it's providing solutions to generating and developing solar cells which are incredibly cost-effective to produce. They're not necessarily more efficient than conventional solar cells, but we can produce them at much lower costs, and we can produce them in much more versatile ways so you can deploy them almost anywhere in a very easy, in some ways, a flexible application. In fact, you can just about see the application we see here. These are solar cells which have been printed onto a surface. So we're not using a technology which is used to produce microchips. We're using a technology which is much more similar to the technology in an inkjet printer, where maybe you put something in one end and out of the other end comes a solar cell which you can then use. And then the final area of nanotechnology application, which I'm not going to say a lot about because Peter after me is going to say an awful lot more about this, but that's the area of medicine, smart medicines in particular. And all I'm going to say here is that this ability to engineer at this incredibly small scale, at this nanoscale, is enabling us to develop very innovative medicines which in effect can treat the disease without harming the patient. And this is a tremendously powerful and potent area of development, and we'll hear a lot about it after I finish speaking. So just to wrap up, I want to hit on 3 particular messages from this global perspective on nanotechnology as we move into the rest of this series of presentations in this meeting. The first message is that nanotechnology is really very, very diverse. You saw that in the application areas that I talked briefly about. Hopefully you saw it in the consumer products that I mentioned. Nanotechnology isn't one particular thing. What it is, it's a set of ideas, or more appropriately, a toolbox, which allows us to take conventional technologies and use them in very unconventional ways. The second thing that I think is very important to realize is nanotechnology is global. This is a technology that already has a global presence. This is a technology which is going to affect everybody around the globe in one way or another. It's not confined to specific regions, specific parts of society. And that has fairly profound implications as to how it's developed, how it's used. And the final point, very simple point, is that nanotechnology is powerful. There is a lot of hype about the technology, but nanotechnology in one way or another is a technology which is going to transform the world we're in. Now that is a cause for a lot of excitement, but it's also a cause to step back and think, how are we going to use this technology responsibly? And of course, with power comes great responsibility, not only in understanding how to use it to maximum effect, but also understanding what some of the negative consequences might be and how to overcome some of those downsides so we actually see a very beneficial technology, a very responsible technology develop. Well, that's all I want to say. As I said, it was a very brief Cook's tour of nanotechnology. Hopefully that's given you a context within which we can address the rest of this meeting. So I'm going to hand it over at that point back to Jeff. Thank you.
Thank you, Andrew. And you were exactly 15 minutes, and that's about as precise as you can get in terms of the remit. Our next speaker is Dr. Piotr Grodzinski, who is the Director of Nanotechnology for Cancer Programs at the Nanotechnology Alliance of the National Cancer Institute at NIH. Dr. Grodzinski received his PhD in Material Sciences from the University of Southern California and is extremely well published. And he will provide an overview, I believe, of new diagnostics and therapies for cancer and provide some comments on barriers to moving this technology into less developed countries. Some. Thank you.
Well, thanks a lot, Jeff, for a kind introduction. Pleasure to be here. Andrew gave a wonderful, broad introduction to what nanotechnology can do and how exciting it is from the perspective of purely creating new science. So now, from a more practical standpoint, question is, can we use it? And he again showed quite a few examples at the end of his presentation. Some of these nanotechnological solutions to solving practical problems which can be solved with other methods but maybe not as well, or cannot be solved with other methods. And we at National Cancer Institute looked at nanotechnology as a potential to new solutions for diagnostics and therapy to cancer. And I will show you in a second why we thought that we need a new paradigm shift, a new approach to that problem. And I will put that mostly in the context of technology development, but as Jeff said, I would relate some of that to how that can impact cancer in developing world and how soon potentially that can happen. So starting from statistics in the United States, which is probably mostly advanced country from the standpoint of treating, of healthcare and treating the disease. Even healthcare here is so expensive. If you look at the progression of the mortality in different types of diseases in the last 50 years, we made great strides, for instance, in treating cardiovascular diseases, and the mortality there dropped by more than half in the last 50 years. Unfortunately, despite great efforts in looking at an early diagnosis and treatment of cancer, essentially mortality is almost the same. In the last 2 years, the new statistics which actually were received with great hope were that between 2005 and 2006, mortality in the U.S. dropped by 300 cases, and between 2006 and 7, or 2004 and 5, and 5 and 6, it's 3,000. But still, over 500,000 people here die from cancer. So these are very slow.
Peter, you need to talk into the microphone
okay.
a little bit closer.
All right. So now, as I said, the death rate in this country is about 500,000 people per year, and significantly higher number live with cancer and live with cancer longer and longer because of better methods of its treatment. Now, if you look at the world, in some cases, and that needs to be stratified, if you look at the statistical bars on that slide, if you look at the world, for cancers with poor prognosis, cancers which are naturally very deadly, for instance, like lung cancer, it really doesn't matter that much if you got lung cancer in the US or England or in Ghana, because in reality, treatment is so ineffective at that time that you will die anyway. But for a number of different cancers which have much better prognosis, like colon rectum, breast, or cervix, there is a significant difference between number of cases and then number of deaths between developing countries and developed countries, which indicates that there is already a number of, and that mostly happens because of well-developed screening methods, or in some cases, like in case of liver cancer or cervical cancer, because of vaccines. So there are already, if you look at that, there are already basically some of the methods which are not necessarily related to nanotechnology, indicating that for a number of different cancers, depending where you are born, your prognosis will be better once you were diagnosed with the disease. And that again is amplified in this slide. If you look at the incidence, and let's say you look at the North America and track it through two other pie charts, incidence in the US is about 13%, but the mortality is only 8%, and prevalence or survival it's 19%. So you see that well-developed, again, diagnostic and treatment techniques make a significant difference. So now issue is, can that be improved further in both developed and developing world by using new approaches to early diagnostic and treatment? And we, as well as many other people, believe that nanotechnology can play a significant role there. And I don't want to read this slide, it's fairly busy, but essentially there is already a strong indication that you can use nanotechnological developments to create and develop early screening methods, early diagnostics methods, which are more sensitive and specific, as compared to the methods which already exist. And that both applies to in vitro and in vivo applications, meaning doing a test from the bodily fluid or doing a test using imaging techniques. And also you can develop techniques which allow to deliver the therapeutic drug or therapeutic treatment locally to the tumor site. And in many cases use much lower dose of the drug, and by that means cause lower side effects, and at the same time be very efficient in the disease treatment. So some of these things have been demonstrated, and in fact, some of the one or two drugs have been already approved by FDA in this country for treatment of breast cancer, and it's tried right now on the other cancers. So when we look at the evolution of these new methodologies and also their interaction with current established therapeutic approaches, we think that this will evolve in such a way that if we develop the techniques which allow for earlier diagnostic at the earlier stage of the cancer, and even if we use the existing method of the therapy because of the recognition of the disease at the earlier stage, ultimately that should contribute to the higher survival rate. If then these diagnostic methods are combined with novel therapy which relies on nanotechnology, then you will have early recognition of the disease and more effective treatment with lower side effects, which again will improve the survivability further. At the latest stage, and I think that the technology development is somewhere at that stage right now. At the latest stage, if you can introduce some of these recognition diagnostic techniques to the in vivo environment, the recognition will occur even earlier, and then treatment should be even more effective. Andrew gave you a very good comparisons of the scale of the nanoscale objects versus and how they scale to the size of the human body. Most of the methods which we are looking at and which we are working on are related to the use of nanoparticles, and they can be made from very different materials, from inorganic materials or organic materials. Bottom line is that they are very, very small. They are about 10 nanometers or 200 nanometers. So basically, they're at the size of the of the golf ball as compared to the size of the moon. If you compare the size of the nanoparticle and size of the body, so they're very, very small, and they can be also trained to be fairly intelligent, meaning they can find the tumor site within the human body and latch there and release the drug subsequently. So now how does that, I mentioned that I will be relating that to the developing world. So how some of these treatments or in general health methodologies can apply to the developing world. And that's a slide borrowed from the paper which Peter Singer wrote, and he will obviously will talk about that much more. But they identified 10 top objectives for nanotechnology in developing world. And the ones which I turned red have a potential to have an impact on cancer diagnosis and treatment. So the general message here is that if these techniques are being made inexpensive and have capability of being distributed very broadly beyond specialized clinics, they have a strong propensity of impacting the developing world. And maybe at some point we can draw a parallel. There is a big project at MIT Media Lab, which is trying to develop the laptop computer, which will cost less than $100, and that at that price that can be distributed to a lot of third world countries. So I think there is a possibility for a parallel in that for nanotechnology in biomedical applications and possibly in cancer in particular. So again, people working in science are very creative and innovative, and they developed a lot of different nano objects, which the common denominator to that is that they are all very small. But they can do a lot of very intelligent things, and they are actually also very, very pretty. They can emit light at very different colors. They have very fascinating shapes, and without getting into detail, they can help because they have these properties. They can help in developing diagnostic assays which have multiplex capabilities for a number of different diseases. So again, if you are capable of developing a test which is very inexpensive and can be run by the person who is not skilled medical professional, you can again bring it to the masses where the cost will be lower and the infrastructure will be not prohibitive. And that example here is more specific and allows to track the biomarkers which are associated with breast cancer using quantum dots, which are one of these small nanoparticles. Again, if you want to do a diagnostic test and do not want to involve skilled person, you may need to use fairly complex laboratory on the chip, which will allow to take a sample from the patient and then treat this sample to a point that it can be applied to the sensor platform, which will then detect the biomarkers of interest. And that's why people are working on structures called microfluidics or nanofluidics, which are basically combinations of small reservoirs and channels, which allow to push the samples through different stages of the processing and eventually diagnose the content of that sample. Now, how nanotechnology can be used to the drug delivery or to the therapy in general? The problem with a lot of chemotherapeutic treatment, which is now a leading treatment for the cancer, is that in addition to improving the health of the patient because of the impact on the tumor, there are significant side effects which at best contribute to the patient discomfort, and at worst may actually deteriorate their health. So objective here is to try to develop techniques which allow to deliver the therapy very locally and impact only tumor cells but not the health tissue around them. And at the same time, if you can deliver this therapy locally, then you can hope that that the dose which you need to use is lower, and by that means you can reduce again the side effects, and patient discomfort will be significantly lower. So in essence, you are trying to treat the patient without killing the patient. That's what Andrew said, discussing it at one of the slides. And so again, these particles can be surprisingly smart, and they're not just dummy small balls. You can decorate them with special biological entities which allow them to find the tumor, then maybe image these tumors through the use of traditional imaging techniques, MRI or ultrasound. And finally, they can also carry the drug which can be released at the tumor site after the tumor was found by the nanoparticle. And by that means, they can allow for the local treatment. And first drug like that, called Abraxane, has been approved by FDA about a year ago. It's not as intelligent or as sophisticated as the drawing on this slide, but nevertheless, it uses the nanoparticle platform as a carrier for paclitaxel, which is chemotherapeutic drug, and because of that, is somewhat more efficient than the free paclitaxel. And you see here, I don't want to go into details, but that has been tested primarily on the patients with breast cancer, but also ovarian, prostate, and colon, and there is an indication of improvement as compared to the treatment with free paclitaxel. And there is a number of advanced studies, which of course didn't reach human yet, but use animal models where particles with this high level of intelligence, for the lack of a better word, when they can target, image, and as well treat tumor, are being used. And again, here you see two families of mice treated with the free drug and drug which is carried by nanoparticles, and you see that these ones are healthier, and also if you look into detail of that study, they also survive much longer. And again, here these mice are not healthy, not because of the tumor, which of course contributes to that, but because of the large dose of the drug. There's another example here where you can use laser light, which is delivered again locally to the tumor tissue and burn the tumor cells, and healthy cells around them survive. So that's another example of that kind of local treatment. The ultimate holy grail of treating the cancer is actually preventing the cancer. If you are capable of reduce the risk of getting it, you will save a lot of money, and you will also save a lot of lives and a lot of discomfort among potential patients. So the question is, usually you try to apply new technologies to the problems which already exist rather than prevent these problems. So question which is interesting, I think, is how to use nanotechnology for prevention of the disease. And indirectly, these early screening methods would be the answer to that question. And also, that also relates to the early imaging techniques, which ultimately will allow to determine presence of the tumor at such an early stage that maybe treatment will not be necessary, or treatment will be much less complicated. So now the question, and again Peter will answer that much better, is how the developing world participates in studies like that. Would it be a scenario where a lot of these technologies for biomedical applications will develop in developed world and then somehow get transferred to the developing world, or actually the developing countries will take initiative and use the limited resources they have to solve some of these problems? And partial answer here is that probably the latter will be the true, at least in some cases. If you look at this graph, when you look at the innovation level, a number of patents which are being written in the area of nanotechnology, the highest is in the United States, but China is number 2. So that's an indication that countries with not such a high level of standard of living are participating in that very strongly. And I borrowed that from the Journal of Nanotechnology, and studies about a year and a half old. And another important thing here is, if you look at the innovation and the potential use of nanotechnology for the particular disease in biomedical application space, again, the same paper quotes that cancer is targeted the most, and partially probably is because it's such a complex disease, and there is a great hope that that approach, relying on nanotechnology tools, can make a big difference here. So now, how did nanotechnology develop in this country or any other country? It's a very complex discipline, which actually puts great emphasis on multidisciplinarity of the research and development. So it requires bringing communities which didn't work traditionally together in case of cancer, of oncologists, clinicians, physical scientists, engineers, and that requires building a common language, developing common interests, and identifying common problems. And the program which we have developed at NCI, we hope is addressing that part quite effectively. And in terms of our involvement, we are spending about $150 million over 5 years, starting in 2005, for the initiative called Cancer Nanotechnology, where we're basically using nanotechnology approaches to the improvement in the effectiveness of fight against cancer. And again, there's a number of different flavors of this, how this funding is being spent. Bottom line is advancement of technology towards diagnosis and treatment of cancer. Nanotechnology in general is also created a lot of anxiety. It's a new thing which has big promises, but creates also some concerns. And there are a number of initiatives related to dealing with environmental and patient impact. And really, there are two major, aspects which people are looking at over there. One is if nanotechnology will mature to a level that these nanoparticles will be produced in large quantities, people who will work in entities like that can be exposed to the very small particles, and ultimately the chronic exposure needs to be studied very, very carefully and prevented. And large part of that is already being done. And the other thing is side effects and clearance of the nanoparticles from the human organism upon the treatment. So to summarize, I think or at least we at NCI, and I think a lot of other people share our opinion, is that nanotechnology provides unique and potentially effective solutions to the cancer problem, mostly in the stage of early screening, early diagnosis, and novel approaches to the therapy. And again, looking at the statistics for cancer incidence and mortality across the world, it's clear that for some cancers, the mortality has been tackled in developed world, but hasn't been tackled yet in developing world because of not broadly distributed screening methods and also not as effective treatment. And we believe that nanotechnology can play the role there. And only question is how this technology will transfer or develop there, and I'm sure Peter will talk about that in more detail. So thanks a lot for your attention.
Okay, thank you, Peter. And our third and last speaker is Peter Singer, who is a professor and senior scientist at the McLaughlin Rotman Center, University Health Network, and a professor of medicine at the University of Toronto, and co-director of the Canadian Program in Genomics and Global Health, and a distinguished investigator of the Canadian Institutes of Health Research. And he studied in very prestigious places, University of Toronto, University of Chicago, Yale, and Harvard. And he will present to us the role of nanotechnologies in achieving the Millennium Development Goals, or what we call the MDGs, and issues about access to such technologies, the differences between first world and third world. Thank you.
Thank you very much. I'm grateful for the invitation to come and speak with you, and grateful to the Woodrow Wilson Center for inviting me. It's a pleasure to be on a panel with such cogent, distinguished folks, and it's great to be here. As advertised, I want to talk about nanotechnology in the developing world. And maybe let me just take a step back. In a former life, I was a bioethicist, and I spent my time running around developing living wills and things like that. and that would improve the care of people, for instance, who were dying in intensive care units in hospitals. And then one day it struck me that those sort of ethical problems we often deal with pale in comparison to what I like to think about as the mother of all ethical challenges, or one of the greatest ethical challenges of our time, which is really the inequities in all sorts of social outcomes, but today we're focused on health between the industrialized and the developing world. Just one shocking statistic is that life expectancy in the United States, in Canada, 80 years and rising. In many parts of sub-Saharan Africa, largely as a result of HIV/AIDS, 40 years and falling. And if that isn't the mother of all ethical challenges, I don't know what is. So that puts into context, if you will, the big picture problem that we're addressing here today. And I'm particularly going to focus on the other 4 or 5 billion people in the world that live outside of the United States and or North America, Europe, and Japan. A few years ago, all the United Nations agencies came together in response to this problem and set what Jeff mentioned, the United Nations Millennium Development Goals. And these are listed on this slide, and I won't go through them. Many of you are probably familiar with them. But this is aiming to be a comprehensive, really set of targets on development that maybe gives a little bit more focus to that ethical challenge I was talking about. I'm going to come back to these later in response to nanotechnology, which is one of the reasons I'm showing them here. There's a number of ways one can address the Millennium Development Goals, and in fact, the UN had a Millennium Task Force looking at that. But one of the key underlying themes or key underlying platforms, and certainly not the only one, in terms of addressing the Millennium Development Goals, is the role of science and technology. And in particular, the UN Millennium Project prepared an analysis of the role of science, technology, and innovation. And in this report shown on this slide, the co-chair, Kalestis Juma, remarkable fellow from the Kennedy School at Harvard University, came to the conclusion that the Millennium Development Goals cannot be achieved without a focused policy for science, technology, and innovation. Well, there's a lot of different types of science, technology, and innovation, and arguably one can look at great waves of science and technology, information technologies, biotechnologies, but today we're focused on nanotechnologies. And I want to therefore, coming from that big picture, zero down on the question, which nanotechnologies are most likely to benefit people in developing countries. We conducted a study using the methods of Letterman et al. You familiar with that, David Letterman? Top 10 list. We conducted a study, sort of Letterman-esque, on a top 10 list, interviewing 63 panelists in 26 countries. These were mostly scientists, mostly in the developing world, all familiar with nanotechnology. We made an effort to balance geography. We made an effort to balance gender. As you can see, we weren't fully successful in that. This represents where the 63 panelists came from. We asked them, what do you think are the nanotechnologies most likely to benefit developing countries? And here's the David Letterman top 10 list, which you've seen before in an earlier slide, published in PLOS Medicine in 2006, on the top 10 nanotechnologies for the developing world. Now, today we're focused on nanotechnology in health. And the point was made earlier in conversation that in some sense, all these things affect health. But the number one issue was actually, and I'll go from the top to the bottom, unlike David Letterman, the number one issue was energy storage, production, and conversion. And I don't think I'll say more about that. Andrew Maynard talked a little bit about energy, and he showed you that film. Piotr talked about energy in relation to cancer. That was the number one issue. Number two, agricultural productivity enhancement, I don't think has been mentioned. A lot of technologies here, you know about sustained release drugs. Well, underlying here is sort of sustained release fertilizers, for instance, and that's an example of something in there. And in this paper, there actually is a listing of the technologies themselves that people talked about. Here, we're talking mostly about domains. Number three, water treatment and remediation. Again, Andrew showed you a slide on that, and I'll have more to say about water. And then we get to the mainline health ones. 4, disease diagnosis and screening. I'm going to focus in on that. Drug delivery systems, number 5, and number 9, health monitoring, with a number of things down the list. So, this isn't the cystic fibrosis gene, but it does provide some focus to efforts, at least in expert opinion, which is what this is, in terms of what technologies or areas or domains one might focus on. And as I say in the paper itself, one goes down to actual technologies and deeper than these domains. So then the question was, how do these technologies, the top 10 technologies, map against the UN Millennium Development Goals? And without going into detail on this slide, let me just tell you that they actually map very well. So in a sense, there is sometimes an antipathy to emerging technologies in relationship to development problems. This slide shows that actually emerging technologies can serve development problems, and there may be more discussion that we'll have about that, the role of public health, the role of emerging technologies in development issues, and that's a very valid discussion to have. And, in short, it has to do with constructing the near-term future in humanitarian crises versus a longer-term sustainable future. But we can get into that if you want in the discussion period. This slide shows a number of the technologies underlying those choices, and many of these have been covered already, so I'll just mention them. Quantum dots, and I'm going to go into an example of quantum dots that I think is actually very compelling. Dendrimers, the lab on a chip for diagnosis, some pictures of it there, and buckyballs. Well, I think examples are very, very powerful. So let me focus in on just one example. This would be in number 4 on the list, diagnosis, but it's the top one that's sort of mainstream health. This project on quantum dots for malaria is actually going on now, funded by an arm's-length federal agency called Genome Canada. The lead investigator is Kevin Kane, who's a malariologist. He works in Toronto as well. And he is developing with a nanotechnology colleague, Warren Chan, the application of quantum dots, a technology that's been mentioned, to the problem of malaria diagnostics. And here you see a picture of some quantum dots, some malaria. But, the problem with malaria, and I was in Ghana, for instance, 2 weeks ago, where 40% of hospital admissions are related to malaria. The problem with malaria, which incidentally kills probably 1 million children, probably closer to 2 million in the developing world every year. The problem with malaria diagnosis is at the moment, the diagnostics are over 100 years old. You have to get the blood, look down the microscope, find the malaria parasite, and that's how you diagnose malaria. And in fact, in many parts of the developing world, you just don't have the infrastructure to do that. So any kid under 5 who looks really sick, you might treat, resulting in a lot of excess use of antimalarials and resistance and so on. So the diagnosis can make a big difference to a huge clinical problem. And this is a very busy slide, but it just makes that point about how the diagnostics can make a difference, and it gets into the role of quantum dots. The bottom line of this slide, which was published recently in a very interesting Nature supplement on diagnostics by the Gates Foundation and the RAND Corporation, is that decreasing, and this is from the malaria article, the bottom line is that decreasing the infrastructure requirement of malaria diagnostic tests saves the most lives. So you probably can't see it, but in the very bottom row is the ideal test. Perfect sensitivity, perfect specificity, and requires no infrastructure. Sort of you can do it at home. And the malaria-related lives saved are about 642,000. Remember, there's about 1 million or 2 million people who actually die of malaria, 1 point something million in this model. And that's 100% of the lives that you can save with diagnostics. And if you could scan up and down, the middle cluster is minimal infrastructure, which is point-of-care diagnostics, which is essentially what quantum dots offers. Some training of a health worker, no real infrastructure requirements. And the top one is modern infrastructure, which is like the microscope. If you scan up and down the sensitivities and specificities and changing the level of infrastructure, you can see, for instance, that as you go from no infrastructure to minimal infrastructure with, say, a perfect test, which you don't have, you get 73% of the effect, saving, averting 230,000 deaths from malaria. However, as you scan up and down on sensitivity and specificity, which is what most test developers think about, actually you lose a lot of the effect. So the bottom line of this is that changing the infrastructure from moderate infrastructure like microscopes, which actually aren't used, to minimal infrastructure like point-of-care diagnostics, like the quantum dots I was showing you, saves hundreds of thousands of lives from malaria. So this is a serious public health issue at stake just from a diagnostic. And one of the innovative things about this set of papers is you don't normally see diagnostics in terms of lives saved. You sort of see that data in relationship to therapeutics. This uses modeling to get that. And, you know, if the numbers are exact or not, who knows in models. But nonetheless, it gives you an idea of the potential impact of just one story, which is actually unfolding now, quantum dots for malaria, on a huge health problem in the developing world. Now, then the question becomes, and this is, I think, where Piotr ended, which is, do you import the stuff or is it made domestically? And I think in the short term, the answer will be both. But the end game has to be domestic innovation in the developing world, or it won't be sustainable. A pure technology transfer issue may help jumpstart things, but the end has to be developing world innovation. This is some of the factors that actually stimulate domestic innovation in the developing world. And this comes not from nanotechnology, but from a study we did on biotechnology, where we studied 7 really emerging economies in developing countries in detail in country-specific case studies on the ground, and found that these were the factors that led to domestic innovation. And I won't read them all. You can just scan them. But there are a set of policy factors that can stimulate domestic innovation in the developing world, and that has to be the long-term play. Why does it have to be? Just to give you an example, take a technology like hepatitis B vaccine, analogous, not nanotechnology. Very effective, prevents liver cancer, has been hanging around for 20 years and not fully delivered for all sorts of reasons, including cost. You can once domestic Indian companies started making hepatitis B vaccine. In this case, the lead one was Shanta Biotechnics. The cost comes down from $20 a dose to 50 cents a dose, and Shanta is now the major supplier into UNICEF. That sort of example is why, in the long term, the end game has to be domestic innovation in the developing world, and also, of course, the idea of targeting local health problems will happen when innovation is close to those problems. In terms of nanotechnology, we haven't yet studied it at the country level in the same level of detail as biotechnology. But here is some preliminary stuff in relationship to what countries are doing. You know, we started off a research project scanning countries, and our theory was we would come up with the nano divide, and we'd sort of promote this idea of the nano divide and like the digital divide and the genomic divide, and that'd be our thing. But when we actually started looking, it was far more nuanced. And we saw a lot of nano activity in the developing world. Take a couple of countries like India and China, and we actually classified them in this paper as front runners, middle ground, and up and comers. The front runners were India and China. Whether those are really developing countries or not, I'm not so sure. At 10% growth a year, they're really emerging economies. But to take China, for instance, there's the development of nanobone at Tsinghua University. To take India, you've got nano-diagnostic systems, nano-drug delivery systems, real products coming out in the market. And that was our rough and tumble taxonomy for front runners. But you've also got middle ground countries like South Africa, Brazil, and other countries, Thailand, Philippines, Chile, where you've got very organized governmental efforts, some private sector involvement, maybe not to the level of products yet, and then up and comers. So the bottom line of this slide is in at least the emerging economies and some developing countries, you're actually starting to see innovation happening. In the short term, I think some combination of technology transfer and facilitating domestic innovation is probably a way to jumpstart it. And we've written about that. We proposed a grand challenges in nanotechnology, which is really just a jump-starting, leapfrogging thing. But the end game has to be domestic innovation in nanotechnology in the developing world for some of the reasons we've discussed. So I want to just stop there A talk can be too long, but it can never be too short, especially when you're the third speaker. And so I'm going to stop there and just to summarize my message like this. We ought to, in everything we do in nanotechnology, be concerned with the other 5 billion people in the world. If we're not concerned, we are going to miss huge opportunities to have major health and other social impacts and exacerbate what really is the mother of all ethical challenges. If we do focus in on this issue, we have the opportunity to save many, many lives in relatively simple ways with relatively low-hanging fruit. To identify what some of those opportunities are, we did a David Letterman study on nano in the developing world. The top things are indirectly related to health, but there are health things there. The top direct health one is diagnostics. And I gave you, I think, a very compelling and concrete example of quantum dots and malaria, not that complicated, that could save hundreds of thousands of lives in Africa, potentially, at least based on the modeling. A lot of other issues to deal with. But in the long term, the end game has to be domestic innovation in the developing world. I gave you the hepatitis B example by analogy, both for cost and culture and being sensitive to local problems, issues. That has to be the end game. And so we ought to be thinking about how we can support countries, how we can help move nano from the emerging economies to the lesser developed countries, and how we can take a nuanced approach to this problem to ensure that any potential nano divide isn't exacerbated but closed through domestic innovation and through partnerships and real good north to south and south to south collaboration. So I just want to thank our funders. There's a picture of the team done this work with Abdullah Dar, who's there in the front row, and particularly want to single out Fabio Salamanca Buentello, a remarkable Mexican physician who really did all of this work. So thank you very much. Look forward to the discussion, and thanks again to the Wilson Center for inviting me.
Peter, thank you very much for that marvelous tour de force. I'm going to stand right now because we promised you at least a half an hour, almost 45 minutes of discussion, and before initiating the discussion, I would like to just make a few remarks from the perspective that I sit in. We've heard 3 very interesting and very complementary presentations. It looked like we all got together and figured out what each is going to say. Well, we actually, a couple of us had a conference call, but it really happened by good planning by the Woodrow Wilson Center. Perhaps I really love that expression that the relative difference between the size of a person and a nanoparticle is the same as between the moon and the head of a pin. You can really relate to nanotechnologies with that analogy. I understand we have a very diverse audience. We have nanotechnology specialists. We have scientists in the group. We have public health people with masters in public health, and we have business people in the group. So our discussion can be very rich when we get to it in a moment or two. For the novices in the room, I hope you got a good taste of the vastness and the capabilities of nanotechnology and nanoparticles to improve the health and well-being of people as well as other applications. There are already numerous nanotechnology-based products available. I think Andrew mentioned at least 400 products that have been approved. I can tell you that I have had several actinic keratoses, and I use a sunscreen. And the sunscreen that I use, I happen to know that was based on nanotechnology, and the inventor of that sunscreen figured out how to solubilize zinc oxide, that white stuff that you see people put on their nose at the beach. How do you solubilize it so you can rub it into your scalp, and it works marvelously. The idea of drugs as diagnostic tools and development of drugs, as we just heard from Peter, is incredibly important and can revolutionize the field of medicine, of public health, and global health. Sort of a thing that Peter Singer was preoccupied with, and that is how are the poorest countries going to benefit from this technology, and I want to make a comment or two about that. This, to some extent, will depend on how many of the new innovations will actually be coming from the laboratories of less developed countries. And then what is the likelihood of that these advances, even in those laboratories, will find their way into the indigenous populations of those countries and not be picked up by somebody else? One of the big issues is how do you develop technologies and then make sure that they are commercialized and made available at preferential prices in low resource settings. And I have myself been working for years on public-private sector agreements to do just that. And my mantra has been that unless you, generally speaking, unless you have a vibrant private sector, that's the locomotive for the production and profit making from new technologies, you will not be able to get people in low resource settings to have access to these products at a preferential price. I sort of like to say that if you have a vibrant private sector, maybe there's hundreds of millions of units of something being made, and what we want to do is buy the last 2 million units on a run of 100 million units, and hence you pay just the marginal cost to produce those last few units with nothing amortized into the cost of the actual goods for the first million units. So when we have that situation, when we can create that vibrant private sector, the public sector can benefit. The other more important, perhaps, is if laboratories and investigators in developing countries and institutions in developing countries are actually making the technology and not just waiting until the technology is off patent and then making generics at a much lower price. So if that work is being done in developing countries, it should streamline the process of getting the products to developing countries. I must say something about cancer, and that is it's a terribly important problem. You saw wonderful slides about cancer, but I can tell you most development assistance agencies and most donors don't put any money in cancer. Not that it isn't important, but there are so many other public health problems in the world, and cancer sort of has really not benefited by support from donor agencies, again, not because it isn't important. And largely, it is a problem in the developing world that isn't going to change until we somehow figure out how to get better technologies and how to get prevention as well as treatment for cancer. I think the HPV vaccine, which I have followed very closely, which our agency doesn't do any work on right now, but I watch it very closely, is going to be very interesting to see how that develops in terms of getting that technology available at a very low price, not $350, into developing countries. Another important, terribly important range of issues related to this is understanding what influences or drives the access to and availability of technologies in resource-poor countries, especially in the health field. Products must be tested for safety, effectiveness, and utility in settings where they will actually be applied. Those applying new technological breakthroughs must have knowledge of the environments. For example, simple one, the ambient temperature, the lack of a cold chain, the realities of the healthcare system, the realities of the way people work in factories in those settings in order to make sure that the benefits will outweigh any of the risks and that they must be carefully studied in the environments where the technology is going to be applied. So to the extent possible, we can prevent unexpected harm to both health and the environment. Finally, before I give up the floor to our discussions, I'd like to remind everybody that the field of medicine and the field of public health is not immune to unfortunate delays in getting new evidence, or what we call best practices, widely applied. I'm sure many of you in this room know or have heard about the 264-year history of how long, which went from 1601 to 1865. That was the amount of time it took for the British Navy and the British Merchant Marines to institute a universal prevention policy to combat scurvy. In 1601, Captain James Cook showed that 3 teaspoons of lemon juice daily prevented 100% of the deaths from scurvy, but yet it took 264 years, again, this was not during the information age, for the British to finally institute a universal prevention of scurvy on ships. Now, a more recent example, which has been brought to my attention by 2 very reliable sources, who I will not mention, and I have not read the paper on this issue, is that in the U.S., even in the age of information overload, it took 13 years for 51% of American cardiologists to treat MIs, myocardial infarctions, correctly, despite widely disseminated information to the medical community on the best treatment for acute MIs, and despite living in the most litigious country in the world. 13 years for 1% higher than half the American cardiologists to treat MIs properly. So it would be a real shame if scientific breakthroughs that come out now take so long to get instituted and they end up becoming the best kept secrets amongst other therapies. Now, for the discussion, I would like everybody to please, when you get the floor, to tell us who you are and what your affiliation is, and to either make a comment if you wish to, or address a question. Tell us which panelist you're addressing it to, or the entire panel. And the floor is open to discuss everything you heard, or the things you didn't hear that you wish you had heard. And I understand if there are people in the overflow room, there are staff there who will take questions and make sure we get their questions answered also. So the floor is open. And we have a microphone roving there. 2 microphones.
Thank you. Heather Jeffen, consulting firm, CEO of consulting firm in Fairfax, Virginia. This is a jackpot of presentation. Super. Thank you all. This is tremendous. We often concern with the safety risk assessment. Technologies always might have some risk in or side effect. And we don't want to apply nanotechnology and then down the road, 20 years later, we discover that it was not as safe as we predicted. Is there any risk assessment standard model that is being used on all this new product to ensure that it's safe, environmentally safe, as well as for use with human beings? Thank you very much.
Let me take first stab at that. Good question. And I think it's fairly clear with nanotechnology, because it is such a new set of technologies, there are inevitably going to be new risks associated with it, and we're beginning to see the science supporting that now. If you look at the very simplest case of nanometer-sized particles, we know they behave differently in the body and in the environment to larger, more conventional particles. So yes, there are going to be a whole new set of risk issues we need to address, and we are beginning to address those. We're beginning to work out what the critical questions are that we need to ask as we develop these technologies. We're beginning along the road to working out how to answer those questions. But there is a long way to go. And I think globally, if we're going to see sustainable nanotechnologies, and by that I mean nanotechnologies which are going to be around for a long time, we've got to integrate our approach to understanding the risks at the same time as we develop the new technologies. And that's going to require quite a substantial investment in new science to understand what those risks are, but also how to translate and transform that information into effective and safe ways of using the technologies.
Thank you.
Okay, let me maybe add a few words. Yeah, so that's certainly true, and there are areas of new evaluation technologies which are being used to very careful biodistribution studies, for instance, in animals, and that will be eventually translated, and that translated further, and that's required for any technology which will be used in vivo and needs to be applied for the approval by FDA or Food and Drug Administration. I think what is very important to look at is that some of the techniques which all of us talked about will be used in vivo environment, meaning they will be used within the body of the person. But there is also a lot of nanotechnologies which can be used in screening techniques, and they really don't have to be tested in such an elaborate manner, because simply they don't impact the patient directly. So some of these studies and developments can be used already for early screening techniques. Even the safety evaluation there is not that elaborate. Then the techniques which will be used in vivo will undergo the elaborate studies, and eventually some of them will be discarded and some of them will be used. Good example, for instance, quantum dots. Quantum dots contain cadmium. People are looking right now for new materials to build these nanoparticles. but cadmium is known to be toxic. So they can be used for in vitro multiplex assays, but probably they will not be used for in vivo imaging.
Just two quick points. One is you could imply from my remarks that I would think that regulatory capacity in the developing world is an important thing to build up. And the reason for that is that when you're looking at risks, it makes a big difference whether there's tens of thousands of children dying of malaria in your country or not. And quantum dots compared to other nanotechnologies would be a particular nuance. So just to put a spin on it, I think if you believe that the innovation in the developing world is an end game, regulation and strengthening regulatory capacity in agencies in the developing world is an important piece of that puzzle.
Yeah, I'm glad you raised that point because that is certainly a concern. And I should tell you that I work in the microbicides field. And in fact, one of the microbicides, these are either oral or vaginal products that would be used to prevent HIV. One of them is based on nanotechnologies that NIAID is now investigating, and that we have actually invested significant resources in bringing together people from ministries of health, from drug regulatory authorities in developing countries to talk about the registration process and the approval process and to see what needs to be beefed up in countries that do not have strong processes to ensure that they can make their own risk assessment. A country like South Africa certainly has the capacity and very professional staff who will look at, able to assess dossiers on products to determine what needs to be done to ensure safety and effectiveness. Okay, next question.
Can I make a comment on the FDA?
You have to use the microphone.
Can I make a comment on the FDA? Is the FDA ready to regulate or evaluate nanotechnology?
The
And
FDA
this
has
is-
already approved several products, and I understand there's dozens of dossiers in front of the FDA right now, and they certainly look at that issue
Are
of
they
safety.
capable of that? Because it is very antiquated agency. Have not.
Well, we don't have anybody from the FDA here, so I think you've raised a good question, and I certainly hope our FDA is in a position to make sound judgments on technologies. Next question, please. Let's get you a microphone. Please state your name and affiliation.
Thank you very much. I'm Daniel Pinto from the Embassy of Brazil, Department of Science and Technology. I wish to thank you all for the very interesting presentation. And I'd like to know a little more. I thought about asking that question to Dr. Grodzinski, but I'd like to hear all of you about it. The opportunities for international cooperation, scientific cooperation in the development of nanotechnology products and joint research. What has been going on and what are the possibilities open for a country such as mine?
Mm-hmm.
You say it's a middle-comer. It's true, over the past few years we've made a big effort, but I'd like to know a little more about what else we could do, for example, in cooperation with the United States.
Mm-hmm.
Thank you very much.
Excellent question. Currently, NIH in general has a portfolio of about $27 billion, about $20 billion of the medical grants per year. Majority of these grants are being spent in the U.S. However, there's a large pool of grants which are open to both domestic and international applications. So if you look carefully at some of the requests for applications, in different arenas, that doesn't apply only to cancer, it applies in general to 27 different institutes within NIH. Some of these grants are open to international applicants. Usually they are required to team up with somebody within the US. In addition to that, there is a number of collaborations which usually are established on the governmental level. And I know that, for instance, National Cancer Institute has one with Ireland, which maybe doesn't apply to the particular topic we're discussing here. And I know that now it's also, there was an agreement signed with India, which again doesn't apply to NIH per se, but to research agencies within the US, which are being encouraged to interact with Indian researchers. So I think there is a number of different initiatives. Usually they not necessarily start at NIH level. It starts with us where it comes to the grants which we open to international applicants. It starts usually at probably State Department level or policy where it comes to signing general agreements among the governments.
I think that in addition to the north to south collaborations, it won't surprise you to hear me say this, a country like Brazil has a huge role in south to south collaborations. Your country is actually very active in south to south collaborations in biotechnology. But if you think about the 200 countries in the world, the handful of industrialized countries, the few emerging economies on that slide, it was the other 120 countries that weren't on that slide. And I think a lot of that work in relation to the benefits of nanotechnology will happen through south-to-south collaboration. And so I just wanted to complement the north-to-south answer with the idea of south-to-south collaborations. They're both, I think, equally important and serve different purposes.
But it certainly is the case that that through the State Department there's usually arrangements made between U.S. and other countries to have a S&T exchange in a particular area. And in my preparation, my readings for this meeting, I read about somewhere around 20 Grand Challenge grants that were in nanotechnologies, and at least half of them were from scientists in developing countries, and many of them had to do with the food issue. So there's a lot going on, and I would imagine, I would hope, at least in the Grand Challenges, there's coordination between the groups working in nanotechnology. I'm not 100% sure. But thank you for that question.
Jeff, I'm from the State Department. I'd be glad to follow up with him on our S&T agreement.
Okay, thank you. Okay.
Hi, I'm Michelle Zainajmi from the U.S. Department of Commerce, the Office of Health. I want to first thank the panelists for the diverse and rich depth of knowledge they brought forth today. I want to follow up on the last goal of the Millennium Goals on the need for development, for partnerships for sustainable development. And as has been discussed today, you really do need partnerships between the private sector, governments, universities, and research institutions to make sure that there is sustainable development of nanotechnology that's also accessible to all the different populations of the world. I wondered if you could talk a bit more on funding sources and policy recommendations regarding either funding set-asides or funding from industry or all these different partners for that domestic innovation in the developing world that was spoken about.
Anybody?
I can talk about funding in the U.S., which is not that relevant to the topic here, probably. So.
Funding for domestic innovation in the developing world, particularly, is what you asked.
Right.
Peter, do you?
Well, I think it's worth separating. You know, we talk about the private sector sort of as a whole, but if you look at even the UN's take on the private sector, moving from the Global Compact, which has a focus on the multinational corporations, to the recent, not so recent, couple of years old UNDP report called Unleashing Entrepreneurship, which has a focus on the domestic private sector in the developing world. That when I was talking about the private sector, that's really what I was talking about, the domestic private sector in the developing world. In terms of funding sources for R&D in the domestic private sector in the developing world, in the end, it's got to be political will on the part of governments in the developing world that actually primarily fund their own programs. That has to be the end game, and you've probably been following the recent African Union stuff, at least in biotechnology, the panel, the recognition on the part of African presidents of the importance of biotechnology and science and technology. That has to be the long-term thing. In the short term, frankly, I think if you looked at the spending of many aid agencies, there are some investments in science and technology that could be made that would be effective in leapfrogging, including private and public sector R&D in the developing world, including north to south and south to south partnerships. I'm unaware of any large-scale funding program focused on nanotechnology that's related to development. We proposed one that we called, I think, Global Challenges or Grand Challenges in Nanotechnology. So for those of you from development agencies here, That's a great thing to be thinking about, the design of such a program. But I think with humble recognition that that's an interim leapfrogging short-term catalytic step. And in the end, if governments in the developing world and in fact the entrepreneurial sector in the developing world doesn't capture the opportunities, all those transitional things will have been for naught.
You'll see in the press release that there is the issue of whether or not donors who provide foreign assistance are putting enough money into science and technology. That's an issue. I coming from a donor agency, and we don't always have a long-term perspective. We look for results quickly, and it's tough to invest in science and technology where, for instance, in nanotechnologies, from what I read, the real miracle is a decade or two away for some of the things that nanotechnology will bring, and that requires a long-term investment. I can tell you that we have had in the past, for instance, in India, a very interesting program that was trying to providing loans to the private sector to develop technology through a granting bank, and that if the technology worked and the profit was to be made, the loan was paid back. If it didn't work, then it was a write-off as a grant. Now, there's opportunities. Our colleague from the State Department could even maybe talk about that later, on what kind of opportunities there might be out there for exchanges in science and technology between the State Department and developing and more developed, less developed countries. Wait, the person with the microphone has the most power. Where is it going?
There's a person there who is
Okay.
trying to ask a question.
Who's got the
Barbara Harthorn
Okay, please, Barbara, go ahead.
from University of California at Santa Barbara, the NSF Center for Nanotechnology and Society. One of the paradoxes that we've observed is that all of the countries in the world who are investing in nanotech research and development claim that that investment will either help them retain their current position in the global economy or will allow them to leapfrog ahead of others in the global economy. I'm wondering if the panel can comment on the specificity of nano health technologies in that argument. Do nano health technologies have a different role to play in that sort of large calculus than the other kinds of technologies that are in development?
Also, maybe I will say a few words about cancer, because that's what I'm interested in, and that's what I know about to a large extent. So I think over there in cancer, the major issue is maintenance of the patients who are diagnosed and then treated and are alive for extended period of time. The cost of that in the U.S. is in trillions of dollars. So you can argue that if some of these technologies will impact and allow for early recognition, that would have a significant cost impact on the healthcare. And probably a lot of the findings in nanotechnology which can be used in cancer application can be also translated to other diseases. And so it can have a multiple impact. So it's not a direct answer to your question, honestly, because I'm trying to show that the nanotechnology in this particular facet of medicine will have a potential impact on the cost structure. Now, would that but on the other hand, that would move the advancement of the medicine in a given country significantly forward. And from what Peter talked about a lot, and I maybe touched upon it a little bit, that impact can be potentially even much higher in developing world.
I think the answer is yes, and with a nuance. The real issue for me isn't health versus energy versus water. It's domestic problems versus global markets. So you can be in India and developing a hepatitis B vaccine, or you can be in India developing an anti-obesity drug. Now, notwithstanding the fact that obesity and diabetes is also a problem in India, as it is everywhere, the real question is, as innovation happens in the developing world, how do you strike the right balance between tackling local health problems or local energy problems or local social problems, the most pressing problems of a country, and developing products for export, which will give you foreign reserves. And I think obviously you need to do both. But the great thing about investing in science and technology on the part of anyone, including domestic governments in the developing world, is it's not just an economic development play. It's a social and economic development play if you're focused on health. I mean, in Brazil, for instance, it's likely going to be Brazilian scientists, in fact has been, that tackle the problem of Chagas disease. And you've got lots of examples like that nobody else is going to do it for you, and you have to develop a sustainable capacity to do it yourself. So I think the answer is yes. It applies to a lesser extent to all those issues, and the real question is domestic versus international products. And I think one needs to strike the right balance. But it's a 2-for-1 deal, which is why I think aid agencies ought to be looking at it. It's the learning to fish rather than getting a fish version of tackling your own local health problems.
But you are correct that there are other technological approaches besides nanotechnology that need investment and will also help to improve the lives of people. So you raised a very good question, and I would remind everybody, while we have a tremendous amount of brilliance in the front of the room, there's also brilliance in the audience. So if somebody wants to answer one of these questions, because you come from a basis that will help you do that, please help us answer some questions that are raised.
My name is Beverly Hong Fincher, from UDC. Can you hear me?
Yes, I'm just going to make sure he gets a microphone.
I also would like to join others in thanking our panelists for giving us this survey course from 101 to 601. Thank you. I just wonder, Professor Maynard gave us a very good comparative, thing about in terms of size. And to help my understanding, could it be something like, when we had the transistor and then the chips and then the neurons and the synapses? Is it that kind of comparison comparable or not?
To a certain extent, certainly to the extent that if we can really get down into the basis of matter and engineer things at that scale, then a whole range of possibilities is opened up. Exactly the same as you saw with the electronics, going from vacuum tubes, which were large things, to transistors, which were smaller things, to integrated circuits, which were smaller still. The smaller the individual components, the more ability you had to create complex things which would solve new problems. And that's very much the same with nanotechnology.
Yeah, I also have, thank you. I have a question for Professor Singh. This nanobone, what does it do to replace the knees? or the hips, the hip bones, or what do they do?
Yeah, so let me answer that question in a general way, and then later we can talk about the specifics of the product. But this is about the relationship between nanomaterial science, bioengineering, and it's sort of the materials version of what Andrew Maynard showed in construction, but in health. It actually is used to replace bone. And in that regard, and again, we get in the specifics of the thing offline, there's a lot of nuances here. Road traffic accidents are an enormous cause of morbidity and mortality in the developing world. Anyone who's tried to walk across the street in a developing country knows that. A lot of road traffic accidents, a lot of fractures, a lot of need for rehab and regeneration. So it's a great example of leapfrogging on an area like that, burns, road traffic accidents, using that sort of novel material. These things are like the cell phones of nano. Why construct landlines when you can go straight to cell phones? Same sort of concepts in some of these nanotechnologies, and nanobone potentially is an example of that.
Somebody mentioned diabetes before, and I read in one of my readings that the future of nanotechnology would be help to deal with the issue of diabetes by either restoring pancreatic function or through some technology that I didn't understand to actually solve some of these problems of terribly important diseases, particularly in India, of diabetes. So we have a question here in the front, and then...
Hello, my name is William Idrisi. I go to Theodore Roosevelt. My question is for Dr. Grodzinski about the treatment of tumors using nanotechnology. It's a two-part question. how do we get the nanotechnology to differentiate between regular cells and tumor cells? And also, will we have to use immunosuppressant drugs to keep the body from rejecting the nanotechnology?
Okay, that's a very good question. So, for the first part, I mean, there are a number of the entities which are expressed on the surface of the tumor cell, which can be targeted specifically with antibodies or aptamers, for instance. So you can decorate the nanoparticle, which then is applied systemically injected into the bloodstream, and then through the leaky vasculature in the proximity of the tumor, it enters the tumor area and can latch through the specific targeting to the tumor cell. So that's the differentiation. In case of most of the therapies which are currently used for cancer, usually at certain point patient develops the resistance to the treatment, and that's why drugs have to be changed quite frequently. And at this point, there is no reason to believe that it will be differently with the nanotechnology drugs, unless new drugs will be developed using nanotechnology concepts. Most of the drugs right now which are being delivered using nanostructure carriers are existing drugs, paclitaxel, methotrexate, and so forth. They are just being decorated into the nanotechnology or nanoparticle-based platform for more efficient delivery. Now, it is possible that nanotechnology will enable development of new drugs, and that hopefully will open entirely new door.
I think it's really, I was really interested when I read about Abraxane.
Yeah.
You mentioned it to me, how what that is tinkering with an existing technology to make it more bioavailable and easier to deliver. So the nanotechnology is used to deliver something that people are already using, but make it much more efficient. And that's one of the things that most people working in development of technology are concerned about. Not just creating something totally new, but how do you improve what exists right now to make it better, either safer, more effective, easier to use. So, did you get the microphone?
Yeah, hi, Jeff. Again, thank you. This was an excellent program and excellent presentations by all of the speakers. I just wanted
State your name and again,
Nancy Carter Foster, Senior Advisor for Health Affairs at the Department of State. And I just wanted to elaborate a bit more about our S&T agreement program, what we do, what we don't do, and what we don't have. And that's mostly money. This is really an effort to try to address the problem that was outlined by one or more of our speakers about developing political will. The agreements are government-to-government agreements to try to get developing countries, for the most part, developing or middle-income countries, to work collaboratively with the U.S. and others. And actually, we actually do have a U.S.-EU S&T agreement as well. To work collaboratively on innovative research and technology transfer of new and innovative scientific research. What we do at the State Department is offer the environment that brings together the governments and the different agencies within the governments for scientific research. We decide collaboratively where we want to prioritize that research area to be in. We pull together the various agencies. We bring together many of the institutes and centers from the NIH. We bring together CDC. I don't know if Steve Blount was supposed to be here. I don't see him. Many of the other agencies, NIST, the National Institute for Standards and Technologies, any agency that's relevant to the issues that we try to collaborate on. And we actually work on projects or programs to help strengthen and enhance collaborative research across the board between the governments. Where necessary, we can also work to bring together NGOs and private sector entities as well. The problem with this effort is that the U.S. Department of State has very little money to put into it. So what we do is work with the sister agencies to have their areas of priority, which are better funded than some of the areas that we might be able to help support. and therefore they can pool their resources, and where we can develop certain priorities, maybe even develop some initiatives which will help to bring supplemental funds to bear. But we work collaboratively. We'd be glad to work with any of our colleagues from the countries that may be represented here by embassy personnel. And if you want, I'll give you my card afterwards and we can follow up. I work for the Desk for Science and Technology. So, thank you.
So another question, because we're going to have a few minutes at the end for the panelists to sort of give us concluding and closing remarks. And we've got about 7 minutes before we're finished. So in the back
Do you
there
want to
was...
just take a bunch of questions and then...
Sure.
Problem?
Why don't we do that?
I have one. I'm Layli Fadi from Meridian Institute. I'm a research associate with our Global Dialogue on Nanotechnology and the Poor. Some of the applications that you've discussed, like the lab-on-a-chip technology or, say, extended relief vaccines, orally administered vaccines, et cetera, hold the most promise for the very poorest and most remote populations of the world. And I'm interested to hear from our panelists about what's being done and what you think needs to be done to sort of set the stage for the introduction of these technologies to these populations in terms of training local populations to use the technology correctly, or even gauging what cultural acceptance of such technologies would be?
My name's Georgia Sambanaris, and I work on private sector development at USAID. And I would like the advice of the panel on how adaptable you feel these technologies are to corporate social responsibility and long-term profitability of micro enterprises or small businesses that would work in healthcare in a distributive way to rural areas. Because what I'm hearing is more, I agree with the science and technology aspect, but currently we do face criticism by a lot of U.S. multinationals that are reluctant to get into these areas due to lack of profitability. And I would like your advice on how you see, whether you see partnerships as a possibility in that area.
One more before we close the questions.
I'm Jeff Zimmerman with Kilpatrick Stockton. Dr. Grodzinski, you had in your paper a chart on patent applications in various countries in the world, and this follows from the comment that was just made, or the question from AID. Unfortunately, one of the things we see happen with emerging technologies and patents is sometimes that those patent rights are purchased by companies that don't necessarily want to deploy the technology because it competes with the more conventional technology they already have in the marketplace. I was wondering if we've seen any of that kind of effect or impact yet that might cause some of these patents to not remain available, and whether the public funding sources of USAID, et cetera, should have some sort of system to make sure that those technologies remain available.
Okay. So we have 3 questions in front of us. One relates to the promise of vaccines for the poorest of the poor and what's being done to help make sure that these people know how to use these products. And we have the question about private sector and corporate responsibility, and is there any profit to be made, and how do you get companies involved? And then we have the last question on patents. So who would like to address any one or all 3 of these?
Why don't you go ahead on patents? Yeah, well, okay, so, well, that's maybe the easiest to start from. So, I mean, I'm certainly not the expert in this area, in the patent arena. That was borrowed from somebody else's publication. I think nanotechnology is facing similar situations as biotechnology. It's very patent-rich area, and people who develop nanotechnology are very protective of their rights, because in reality, most of the commercialization of nanotechnology occurs through small companies, similar to what happened to biotechnology in the last 25 years. So companies like that, in many cases, build protective portfolios, not necessarily of only what they are working on currently, but also of something which they anticipate will be important 10 years forward. And they are trying to basically fence their potential area of impact. So from that perspective, as in biotechnology, probably it will become very complex. There will be a lot of cross-licensing, and a lot of litigation going along with it. Now, I think at the same time, looking at this chart which I showed, if there is a lot of patent activity in countries like China, in addition to usual suspects of the US and few European countries, I think this will lessen the difficulty, because if we're, at least from the concept of developing or emerging economies world, if the technology is developed locally, there will sooner or later there will be a push to release this technology and use it broadly. And the example of the vaccine, which Peter is probably is a good example. Again, I speak as I learn from what I hear here. But so intuitively, I would say that I don't think there is a danger of having all development and all patent activity conglomerated in few very well developed countries, and then them releasing it or not to developing world, looking at the business aspect. I think, first of all, as Peter said, very important issue is to develop these technologies everywhere, because ultimately that contributes to broad distribution. And from this chart, at least, we already see that in some economies, which are maybe more structured and more top-down driven, these activities are occurring very strongly already.
So it's almost impossible to do justice to the other couple of questions, which were really fantastic. But let me take a couple of quick bullets. Firstly, on the CSR thing, often we talk about that in relation to multinationals, corporate social responsibility. There's a number of companies, for instance, in the water field that could do a lot worse. A number of companies in the water field, for instance, that could do a lot worse than deal with 50 million people with arsenic poisoning in Bangladesh. However, part of the question had to do really with the convergence of civil society and private sector approaches in the developing world. And so I think examples like BRAC, the world's largest NGO that owns a number of private businesses, and a very interesting recent article by Pralahad in the Harvard Business Review last month on the convergence between the private sector and civil society in the developing world is really something. I'll just put a placeholder there, but the question went there. The Meridian Institute, which you represent, has obviously done a terrific amount of work on this topic. And if the panel was on water, we would be changing places, because your focus on water and the real look at those technologies and the global dialogue you've had has been terrific. The science of adoption of technologies is pitiful. We have so little understanding of the complex factors. We don't have a theory of development and adoption of technology in the developing world. We've recently developed a set of dashboards and models around that, but just to highlight that that's a huge issue where the best short-term solution, I think, is for teams of social scientists and others to work in partnership with scientists, because if you can't deliver something, it's not worth having developed in the first place. And in closing, the whole set of issues leads to the question of public engagement. So you've really got a couple of options. One is to take a beautifully eloquent person like Andrew and clone him a number of times and send him into every pub and cafe in the world to talk about nanotechnology. I think that would be a great strategy. I don't know how good you guys are on cloning people here, and what I'm really trying to say is you could walk into a pub in the United States or a coffee shop here in Washington. You could say DNA and everyone would know what you were talking about, and they'd start to talk about genetic privacy. You could walk in and you could say nanotechnology and their eyes would gloss over. And until we get to the point that they're equivalent, none of this stuff is really going to happen, because you need that broad public support for any move in the area. And so just in closing, and I can elaborate on this a little bit in the closing comments, although this is probably it, we developed a website, which is, if you can't clone Andrew and other approaches through the internet, at www.waterengage.com. That's a beta site, but it deals with global water problems, technology solutions. And the real idea there is to create a community, an online community that can talk about the technologies, where school children in Bangladesh can deal with school children in Canada and in San Francisco. where you can discuss some of the risks and contextualize them, where you can look at the technologies, and that's another approach to public engagement. And I end up on public engagement because we covered so much great ground, including those last couple of questions. But the one big thing we didn't really talk about was public engagement, except Andrew demonstrated it so beautifully, as did Piotr. And I think that that really is something that's worth focusing on. And so maybe just that waterengage.com thing is one way of approaching it that some of you might be interested in.
Sum up, say anything at the close here?
Sure, yeah, I can say a few words, certainly.
Microphone.
I think that, as all of us said to some extent, nanotechnology can impact a lot of facets of everybody's life in both developed and not so developed world. And that we see through such trivial examples as coating of the tie or coating of a shirt and better golf balls. I think that the real value of that can be in very emotional issue, which is health issue. And especially, again, I'm coming to cancer because simply that's close to what I do every day. If you have a disease in which in many, many cases you really have no hope, even in 21st century, people are dying of lung cancer, of brain cancers within 3 to 6 months of the diagnosis. And if there is a potential that a given technology can slightly at least change the situation, because if you introduce new drug right now for cancer, if it extends life by 3 months as compared to what is on the market, that is already considered a successful entry. So if some of these developments in nanotechnology can offer improvement of the situation, that would be an incredible achievement for everybody in the world. And unfortunately, probably people in developing world will have slower access to that than we will have here, but eventually it will get there as well.
Just one very brief closing observation. That is, certainly as far as I see it, nanotechnology is an accessible technology. There are many people that would argue that it's a very complex technology and it's really the domain of the few or the purview of the few. I would actually strongly disagree with that. I think it's such a multifaceted technology that it's something that many, many people can engage in and invest in from a very, very small level up to a very complex level. That makes it very different from many other technologies that have come along. It makes it very, very exciting, especially when you look at the global perspective on nanotechnology. Thank you.
Well, I want to thank everyone.